Don't ignore blood in your urine as a man that is 45, 50 years and above, and you notice blood in your urine, blood in your ejaculation. That's when you release sperm. You notice blood in the sperm. You don't ignore that. You notice that you're having difficulty in passing urine. You don't ignore that. You notice that somehow you're having unexplained back pain, low back pain, numbness in your feet, pain that radiates down the waist and down to the leg. You don't ignore that. Any form of back pain in an elderly male in Nigeria should not be ignored. Today, prostate cancer accounts for between 11 to 29% of all male cancers in Nigeria. It's actually prostate cancer is actually the highest cancer in men in Nigeria as at moment, and therefore it's important not to ignore early warning signs, that there could be a problem. Usually what we advocate is for any man that is 45 and above to have regular checkup, which mostly what we call the prostatic specific antigen test, a blood test, and also pelvic ultrasound, as simple as that. That helps you to see the level of the PSA. Normal level is usually from 0 to 4, and so when you begin to have levels that are higher or much higher than 4, it will be indicative that you need further checkup. Prostate volume also should be checked to see if the prostate is enlarging unusually. Even though it is known also that in men, as a man advances in age, the prostate ordinarily sometimes enlarges, just as we call it benign prostatic hypertrophy. But what we are focusing on today is cancer of the prostate. It is important to catch it early, just like any other cancer, because when it is picked up early, the treatment is simpler. The treatment can be 100% curative, and people have been cured completely, and they go back to their normal life. But when it's been identified or diagnosed when it has gone to stage 4 or when it has spread to other organs, it becomes a lot more difficult, a lot more protracted in the treatment that has to follow, and the patient will suffer unduly for this. So it is important, extremely important, for men that also come from a family where a member of that family has been diagnosed with prostate cancer before, or any other cancer for that matter, that such individuals also seek frequent medical checkup, just preventive, as we call it, preventive medical checks. We advocate 6 monthly checks. We advocate annually checks, depending on the age of the individual and depending on the level of the PSA that you're getting. But I will repeat, don't ignore early warning signs. When a man is having difficulty with passing urine, or the flow of the urine has become a bit weak, or you're beginning to feel that when you pass urine, a certain quantity still remains in the bladder, and you are passing urine frequently, in that sense, don't ignore it. It's important to go seek medical attention so that the doctor can conduct as simple as the PSA test that I mentioned, as simple as pelvic ultrasound, so that if there are signs that there could be something happening in your prostate, further tests can then be done. Among the further tests that are usually done is MRI of the pelvis to properly evaluate the prostate, as simple as direct digital exam, where the doctor inserts the finger through the anus, examines the prostate, to feel the consistency of the prostate. That also it can be done as an evaluation for the prostate. But ultimately, where cancer is suspected, there is what we call prostate biopsy, which can be done to send the tissues for histology, so that the tissue can be properly examined in the lab. So these are things that can be done, but of course you don't go up to the level of biopsy until there is a high index of suspicion that there is actually something going on in the prostate. And that index of suspicion could simply be rising titer or rising levels of your PSA from one checkup to another. Even though there are several other causes of elevated PSA, those other causes can then be also examined by your doctor, so that if it is ordinary infection of the prostate that is causing your PSA to rise, antibiotics will treat that and the individual will be okay and the PSA will drop. So the PSA, of course, is just a screening test, and being a screening test, there are some other things that can cause the elevation of the PSA. The reason you need your specialist is so that your specialist will be able to eliminate the other possible causes. But in doing so, attention is paid so that if there is any indication that there could be a cancer going on, it can then be properly evaluated and picked up early. So this is something that any man that is from 45 years, 50 and above, if you come from a family with history of prostate cancer in the past or any other cancer for that matter, pay attention to these things and then have early preventive medical checkup. We call it preventive, not that the checkup prevents cancer, but the checkup prevents the disease from spreading to other tissues, from advancing before it is picked up. We've seen situations where the cancer of the prostate is only being picked up when it has already spread to the bones, when it has already spread to the spine, when it has already spread to other organs like the lungs or the liver and all of that. So it is important that early diagnosis prevents that sort of situation where it is already a stage 4 cancer before it is picked up. And that will be our cancer for today. In our next session, we're going to be talking about the breast cancer, also as one of the commonest causes of cancer deaths in Nigeria. So but for today, let's heed the advice, go get the checkup, and it's as simple as a simple blood test that your doctor will conduct, just to know if you run any risk of prostate cancer or not. Thank you.